Rheumatoid arthritis, also called RA, is often a painful disease and can cause inflammation, fatigue, and discomfort. Depending on severity, RA may impact everyday activities and people's quality of life. I'm here with a leading rheumatologist, Dr. Vibeke Strand. Dr. Strand treats many patients living with RA, conducts quality of life studies, and researches RA medications at Stanford University. Welcome, Dr. Strand.
Thank you.
Dr. Strand, as a rheumatologist, can you tell us a little more about RA and some of the symptoms?
Yes, rheumatoid arthritis is an autoimmune disease. It's a systemic disease, but it primarily affects the joints. And it starts often in the hands and the feet, but it then spreads to the hips, the knees, shoulders, wrists. It basically affects virtually every part of the body. If it's left uncontrolled, it can also affect internal organs. And we don't really know how rheumatoid arthritis starts and why it persists. What we understand is that as an autoimmune disease, the body is actually attacking its own self.
Based on your experience, what are the major challenges that women face with RA?
Well, I think the challenges are physical. They're the challenges of having inflamed joints, having morning stiffness, having the fatigue and low energy that's associated with RA, and also the challenge of controlling the pain that's associated with RA. We have a lot of new medications in the past decade that can really make a difference in controlling rheumatoid arthritis, but none of them are a cure, and therefore people still have to be able to manage their disease and recognize that they're going to have good days and bad days. And part and parcel of that is controlling pain as well as controlling the disease itself.
What are the effects of pain?
Well, pain, I think, affects virtually every part of life. And patients really need to tell their physicians that they're having pain, when they're having pain. Often there's good days and the bad days are the days when there are flares and pain is very severe. Controlling pain means then that you can do the activities that you want. That means you can work, it means you can do your housework, it means you can participate with your family. And it's very important to allow your loved ones and your friends to know what's happening to you and when you're having good and bad days, because actually they want to help, and they'll be very willing to help. But I think one of the big concerns that I have is that we don't adequately control pain, and it's different than just controlling the disease itself.
Dr. Strand, what can people living with RA expect to experience physically?
It's hard to say now because when you treat RA, oftentimes we can be quite successful. But I think what's important is that it doesn't go away. So you need to expect that it's something you're going to have to make peace with and live with and learn to manage yourself. It needs to be something that you manage with your rheumatologist, that you have a treatment plan, and that you follow those goals to become as healthy as you possibly can. It means a proactive response to the disease, and it also means a healthy lifestyle so that you're balancing activities with rest, that you're eating well, that you shouldn't be smoking because we know that smokers don't respond as well to the medications.
What advice do you give your patients to support their aspirations of living beyond the boundaries of RA?
Well, I encourage them to live well beyond the boundaries and to be expectant of being able to do that. I also encourage them to be very open with their physician about how the disease is affecting them and what their goals are. I suggest strongly that they let their family and their friends know what's up with them, because we know that the pain of arthritis has often affected not just family relationships, but also has led to even divorces and separation, and certainly affects sexual activities, something that we don't talk about, but we should. I really encourage people to exercise. As I said, balance activities and rest, but also exercise is very, very important, and to make sure that the joints that are affected are really used carefully on a daily basis.
Thank you, Dr. Strand. Next, we will continue our conversation with Dr. Strand and also speak with medical expert Dr. Pamela Peeke about the physical realities of living with RA and chronic inflammation. Please join us, and remember to check out healthywomen.org for helpful tools and materials. And you can find more tips on how to customize your exercise routine on reachbeyondra.com.